Hi everyone, my name is Dan. I'm an orthopedic nurse practitioner and a nurse practitioner here at Right Device, as well as a patient partner. Due to the highly infectious nature and the severity of the coronavirus, the best option at this time will probably be best to postpone your elective surgery. But unfortunately, some people and some patients may find themselves in a situation where postponing their surgery may not be an option. So this vlog series is meant to talk about what you can expect during your surgical experience. In part one, we talk about the additional risk factors that come with coronavirus, and hopefully it'll help facilitate a discussion between your surgeon, your medical team, as well as yourself to decide what's the best option and what's the safest option for you. Of course, one of the biggest risks of having surgery at this time is actually getting the coronavirus. Even before the coronavirus, the risk of infection is one that's taken very seriously, and the hospitals have very strict policies in place in order to reduce the amount of infections. But of course, with the coronavirus, it adds an additional layer of risk to it. So the virus itself is spread through respiratory droplets, such as when someone sneezes or coughs. And that's why the mask is such a great way to prevent primary transmission of this virus. It prevents a physical barrier which stops most of the droplets. So whenever you're out in public, in a doctor's office, or in the hospital especially, it's very important to wear a mask. Another risk factor in a coronavirus infection is that the risk of severity of this illness increases with age. 8 in 10 of COVID-related deaths have been in adults 65 years or older. Many patients with underlying medical conditions are at risk for severe illness, especially those who are immunocompromised or may have had a respiratory condition. So some of these may be cancer, chronic kidney disease, COPD or asthma, obesity, type 2 diabetes, serious heart conditions such as a previous heart attack or coronary artery disease. Sickle cell disease is one. We've included the full list from the CDC in our descriptions below. So another factor that many people may not think of at first is the limited post-op services that may be available after surgery. The post-op recovery phase is one of the most important phases in the surgical experience. And many times, even under normal circumstances, patients will need additional help at home to go through the daily activities. So many times after surgery, services are included if you get discharged home, such as a home health aide to help you around the house, or a visiting nurse that comes to check on your wound or dressing to make sure everything's okay. As well as sometimes physical or occupational therapy may come to your home and do therapy in-house before going to an outpatient clinic. And sometimes, if patients do not progress after surgery as quickly as they expect, rehab facilities are an option as well. And all of these services have been affected by the coronavirus in one way or another. So there may be a little bit more difficulty or delay in obtaining these services. So you may have to have more help from your friends or family than you originally thought. And that is something to keep in mind as you think about it. So the third risk factor is an increased risk of postoperative death with the coronavirus. A study out of the UK showed that patients who underwent surgery after contracting the coronavirus had mortality rates that approached those of patients who contracted the virus in the community and were admitted to the ICU. So if you do test positive in your pre-op screening, it'd be best to postpone your surgery beyond 2 weeks, and definitely get follow-up testing to show that you're negative. So the coronavirus has added on an extra layer of complexity to an already complex process. We believe that becoming educated in all the risk factors and knowing what to expect will help you have a better discussion with your medical and surgical team to decide what the best option for you is, as well as to have the best outcome. If surgery can't be avoided, then definitely check out part 2 of our vlog series, where we talk about what to expect and the changes that may occur during the pre-op, operative, and post-op process in these crazy times. Definitely hit our subscribe button as well as follow our social media accounts on Facebook, Twitter, and Instagram for any new updates and new videos that may come out.